This is a video demonstrating the use of the Safe Surgery Checklist. We are always keen to provide the safest care for our patients, and the Leeds Dental Institute Safe Surgery Checklist can help us with that goal. This is what the list looks like. It is available from the oral surgery department. The checklist should be used whenever any dental surgery is performed, including dental extractions. It is designed to help us to ensure that we safely perform the correct procedure for each patient. The form is broken down into sections: patient details and a check of the plan prior to calling your patient. Checks to be performed when the patient is present. A formal timeout immediately prior to treatment. And post-operative checks or sign-out and a debrief. In this scenario, we will watch a clinician, Helen, demonstrate the process of using the checklist whilst working with her assistant, Beth. She will do this to perform an extraction for a patient. The operating clinician, whether it is a qualified clinician or a student, will be the person responsible for completion of the form. So here we see Helen reviewing the notes of a patient. The patient attended a consultation appointment previously and has been referred to Helen's surgical list for removal of a tooth. Helen starts by completing the patient identifier section of the checklist with the patient's name and either the PAS or NHS number. She is then checking the treatment plan, cross-referencing the original referral and the electronic patient record. Where appropriate, radiographs are reviewed and a note is made on the form recording the location of the images. In this case, a good quality scanned radiograph was found on the original referral letter on Salud. For this patient, a consent form for the procedure was completed and signed by the patient at the consultation appointment previously. In some cases, such as emergency treatment, the treatment plan and consent will need to be completed at the treatment visit. Having checked the plan, Helen is now completing the checklist with a written treatment plan, which includes a diagnosis or indication for the treatment. It's now useful to go through the plan and checklist with your colleague.
So Beth, we've got Miss Testy Test in this morning for extraction of the upper right 4. I've checked her notes and she came in December for first consent, so everything should be in order with that. Are you okay to fill in the whiteboard?
Yeah.
Thank you.
The whiteboard is now completed with the patient's initials, date of birth, NHS number, and in this case an indication of which tooth is to be extracted.
Thank you. So I think we're ready to get the patient in now.
Yeah.
So the next section on the checklist is completed when the patient is present.
Good morning, my name's Helen. I'll be looking after you today and doing your treatment for you.
First, the name and date of birth are checked on the documents and with the patient.
Can I just confirm your name is Miss Testy Test and your date of birth is the 1st of the 1st, 2001?
Yeah, it is.
Super. Great stuff. So we've just got a few other checks to do before we start.
The medical history is reviewed, including any allergies.
I've been having a look at last visit, and on your medical history it says you suffer with mild asthma and you have an inhaler for that, is that correct?
Yeah, that's correct.
Is there anything else that we need to be aware of?
No.
And have you got any allergies to anything?
No.
Great.
The treatment plan is checked with the patient.
Okay, so do you know which tooth it is that you're having out?
It's this one.
Yeah, the number 4 from the back. That's because you're going to have some braces put on afterwards to straighten the teeth.
If all of the prior checks are correct, consent is gained. In this case, it is confirmation of a previously completed consent form. The whiteboard is
And
checked.
then just to check, it's Miss Testy Test. Date of birth is 1st of the 1st, 2001, and we're taking out the upper right 4th tooth.
Yeah, that's correct.
If all of the checks are in agreement, preparation for the treatment can proceed. Obviously, in a real clinical situation, Helen and Beth would be wearing the appropriate clinical gowns. Immediately prior to the procedure, it is important to have a formal time out.
Okay, so we'll just do a timeout before we take your tooth out. Okay, so just to confirm, we're taking out the upper right four, and that's this one here, Tessie, okay?
Wherever possible, count back onto each tooth which is to be removed.
Okay, so we'll just go 1, 2, 3, 4. Can you put your chin up in the air for me? That's perfect.
Once the procedure is completed, you can indicate that a timeout was performed.
After that time, you may experience a bit of pain, in which you would take some painkillers that you would for a headache.
Indicate that the procedure went to plan. If there is a pathology specimen to send, indicate this. Now complete your treatment record and then indicate on the checklist that the procedure is documented in the patient records and on which system the notes have been made. Then a debrief should be performed to check if there were any equipment issues and if anything could have been done to make the procedure more safe.
Okay, we just need to do a debrief for today's appointment, Beth. Were there any equipment issues or problems to be addressed? No. Any comments? Could anything have been done to make this procedure safer or more efficient?
No.
Then both operator and tutor or assistant in this case sign the form. It is important to ensure that the whiteboard is cleared. Following these steps will ensure best practice at all times when performing surgical dental procedures.